still gonna miss me when I'm gone.
Anna Kendrick, 105.1 The Buzz with Daria, Mitch, and Ted. And we welcome
No,
to
I'm
the
not
show
going to pound Mountain Dew at 6 in the evening. I'll be up all night.
Mountain Dew drinker and cosmetic surgeon, Dr. Michael Workman.
He's just trying to play. And it's diet. Okay, I was going to say.
Oh,
my
of course
goodness.
it's
It's still
diet.
full of caffeine, though.
It's very full of caffeine.
Full of caffeine.
So yes, that is one of the tricks of the trade to keep him ever ready.
We're always ready, yeah.
I have a question for you that I don't know that we've asked before. Oh, by the way, if you don't know who Dr. Michael Workman is, he's a friend of ours. He's one of the best plastic surgeons in the
West
Pacific
Coast.
Northwest. And his area of speciality is everything from the neck on down. He has performed more breast augmentations than any other surgeon of his kind. And he's a lunatic.
In the best way possible.
Thank you very little.
And we love him. So I know with the face, because we've asked this of doctors in the past, that when gravity hits the face, which it does so very early, you girls out there with your taut skin.
You think
just
you're all big and
wait.
tough now.
You age faster than a fruit fly. So the gravity process starts from the bottom and works its way up. So the jowly area, the loose stuff around the jawline, that you're going to notice that probably first.
Correct.
Is the same true for the body? Does gravity work on the body like a certain way, or is it mainly like the juicier parts droop the first?
I think a lot of it depends upon how much sun exposure you've had. And I'll give you a perfect example. Women who have had a lot of truncal sun exposure, i.e., in the front of their abdomen, oftentimes in their late 30s or early 40s start getting all these fine lines, and that skin just starts going to mush. And so that's one area where we tend to see a lot of actinic damage. The other thing to keep in mind is there are certain areas in the body where the skin is very firmly attached to the underlying tissue. In other words, right to the side of the hip, right in the middle, in between the breast and the sternum, there's an area. And there's certain areas where the skin is attached very firmly so that it won't drop near as quickly. And I think that's part of what you're getting at.
When I grew up, I remember when the first tanning salon came to town, and it was a mighty day of celebration for me and and every girl roughly in my age demo.
Yeah.
And because it was something to do, and also we'd be tan in the winter for winter formal, and we would tan. We would go in those things and lay there. We had beautiful tan bellies, which we would then cover. Because we were modest and shy.
Of course you were.
But there's a lot of tanning. But part of that is genetic too, right? I mean, some people can withstand sun damage more than others.
Oh, absolutely. I think some people's skin is much more resistant to actinic or sun damage. The other thing in terms of tanning, we can do a lot for the face, but we can't do near as much for the neck in terms of the skin quality.
Why?
Because
it's so delicate?
Well, a lot of it has to do with the fact that there aren't sweat glands in the neck, or there aren't near as many. So that let's say, for instance,
I've seen Mitch's neck sweat.
I sweat on my fingernails.
Everywhere.
I sweat everywhere.
It's like squeezing a sponge.
But we have to be much, much more careful when we do laser on the neck than we do on the face. Facial laser is the most unbelievable procedure out there. I mean, it'll take 10 to 15 years of sun damage off someone's face. It's just crazy good. But we can't use the same laser on the neck in terms of having the results. And that's why keep those necks out of the sun, ladies.
Wear like a neck thing.
Wear a
when you go-
turtleneck.
when you go-
A dickie.
Yeah, wear a dickie. Get a beach dickie. And put it around your neck. And then go out and be
I just
like,
set up a little hut.
hey.
Mitch's
Or
beach
get one of those
dickies.
neck brace things to put around.
That'd be lovely.
And then
Yeah.
you get sympathy drinks and all kinds of
That's
good
a
stuff.
great idea.
Oh, you poor
Sympathy
dear.
drinks.
Well, you're out there,
Hurt
you
your
go out
neck.
to go tanning, and like, oh, I hurt my neck. And people
But-
are
and I
like,
want a
let me get you some.
drink.
Yeah.
Well, then
but
limp.
it hurts to get up and go.
limp, yes.
We'll bring it to you. We'll give you straws. You don't even have to move.
But then drag one leg behind.
Sure.
Just up the ante if you want to, but then you have to be careful how you drink it because you can't have shots because then you'll be tossing it back and they'll be like, your neck, hold on.
I have a breast question for you. Have
Sure.
you heard of a brand new procedure called an under-the-skin bra operation?
Why
They're doing it in London.
But why you?
Well, they've been talking about...
It's fascinating, though. They
Never
basically
has
tell me
anything
more.
to
They
do
put
with-
little silicone cups under breasts, and they
Okay.
attach these straps to your ribs.
This
Really?
sounds unnecessary and ridiculous.
Well, that's what I thought. There's a picture of it here. It's like, why would you want to do that? Because what you're doing works so well with breast implants.
What?
Yeah.
What?
I'm not sure if it's. I haven't seen that it's been approved to do in the United States.
Is this for your moves? Is it for your moves?
It's for, yeah, it's
I don't
for,
want my moves any higher. I want them gone.
no, absolutely.
Under skin bra, isn't that something? I don't know that it's a good idea, but it's
I
something.
mean, I just got back from our big meeting, and they didn't talk about.
They didn't
that at
mention
all.
the under
No.
the skin bra.
No.
This may not be a real thing.
So,
Yeah.
so your plastic surgeon's meeting maybe is a little behind Mitch's research on the internet.
Well, he's cutting edge. Nobody ever said he wasn't cutting edge.
That's the truth.
Dr.
Mitch
Michael
frequents
Workman.
the Star Magazine section of the internet.
Absolutely.
Dr. Michael Workman is a wonderful plastic surgeon and a wonderful guy. You can find out more information about him and his practice at drmichaelworkman.com. And that's linkable from the Daria, Mitch, and Ted section of 105.1 The Buzz as well.
Thanks, Doc.